Welcome to Beyond Extraordinary, brought to you by LCMC Health. We are an 8-hospital system providing health, care, and education to the greater New Orleans area. We are a health system with 3 academic medical centers, and our AMC status means we have our finger on the pulse of the latest treatments and technologies in medicine, and we're bringing it right to our community. I'm your host, Caroline Giepert, Public Relations Specialist. Today, we're joined by Dr. Benjamin Watkins, a nationally renowned pediatric hematologist and oncologist who serves as the director of the Stem Cell Transplant and Cell Therapy Program at Manning Family Children's Center for Cancer and Blood Disorders, as well as in the Department of Pediatrics for Tulane University School of Medicine. Dr. Watkins, thank you so much for taking the time to join us today. We are so happy to have you here.
Thank you. Happy to be here.
Dr. Watkins, you're leading one of the most advanced pediatric stem cell transplant and gene therapy programs in the region. Can you start by telling us a bit about your background and what led you to specialize in hematology and ultimately in cell and gene therapy?
Yeah, so I can start back at the beginning. I grew up in rural Arkansas in the Ozark Mountains on a blueberry farm, actually. So in a log cabin 5 miles down the dirt road. For some reason, I don't know why, but at about the age of 5 or 6, I knew I wanted to be a pediatrician. So I don't really recall exactly what was the impetus for that, but I knew from a very early age that's what I wanted to be. And so, when I got into medical school and was really thinking about what I wanted to be and what I wanted my career to look like, I was always drawn to the relationships you form with families. And so that was really important to me, to have these strong bonds with the people that we treat. And as going on rotations, I found that particularly with hematology and oncology, you're really going on that journey with them and you become very connected. And that brought a lot of fulfillment in being able to be, close with the families that we treat.
Thanks for sharing that background, and what a beautiful upbringing and story. Let's level set for our audience. Can you give us an overview of sickle cell disease and its impact, not just on patients, but on health systems and health equity, particularly here in the Gulf South?
Yeah, to kind of start about the origin of sickle cell is that it really came out of stress in the environment due to malaria. And so it was actually an adaptation that people developed to hopefully avoid the serious nature of malaria. So people who have a single mutation in their genes that results in sickle cell trait actually shows some protection against the severe forms of malaria. And so a large part of this originated out of sub-Saharan Africa because that's where malaria was the most prevalent. But unfortunately, when you have 2 mutations, you don't have sickle cell trait anymore, you have the disease. And that can be really impactful. And the reason why sickle cell disease is so serious is it affects the shape of your blood cells or your hemoglobin. And so our red blood cells are nice and round and roll through our blood vessels easily. However, in a patient with sickle cell, that mutation results in fragility of the membrane of the red blood cell. So what keeps it so nice and round, free-flowing through our vessels. So under stress, a patient with sickle cell, that red blood cell will collapse and form what's a sickle shape. And so for those that don't know, because not a lot of people use sickle is kind of a crescent shape. And so instead of rolling smoothly through the blood vessels, it can get trapped, especially in the really small blood vessels. Those crescent-shaped cells will start to occlude the blood vessels or stop blood flow to the tissues and bone and other organs that are after that clot is formed. And so that's where a lot of the symptoms of sickle cell come from. It's because of pain, because of lack of oxygen to the tissue. It results in pneumonias. It can result in what's called acute chest syndrome, which is the pneumonia of the chest. It can result in stroke. It can result in damage to the bones, kidney failure. But these cells are so fragile, they are also more likely to break apart. So you're anemic. And so chronic anemia can lead to heart failure. And so basically sickle cell disease can affect every organ of our body.
Most people don't realize that this can be so systemic because wherever blood flows in our body, it can impact that. And due to the severe pain that this often causes, and because sickle cell is often misunderstood, it often can present as that patient is drug seeking.
Exactly, because pain is not something, you don't have a test for this. I can tell you if a patient with sickle cell has a stroke, you do an MRI and you can see it. You can tell when they have acute chest syndrome because you do a chest X-ray. But someone that comes in with pain, there's nothing other than some vital sign changes that tell you that they're in pain. And so I think that leads to a lot of challenges with our medical system in trusting our patients and believing that they're in pain. But it's definitely it can be a very painful disease.
Sickle cell disease has traditionally been managed rather than cured. How has the treatment landscape evolved over the past decade, and where have the biggest gaps remained?
Yeah, so I think we can talk about a couple of different things as it relates to the potential for cure or disease-modifying things that we can do. I think it's important to acknowledge that there's also not all patients need these new advanced therapies. The vast majority of people with sickle cell live long, productive, full lives and are able to manage their disease. But there's some patients who, despite doing everything right, taking all the medication that's prescribed, doing everything to protect themselves, still suffer tremendously. And so these new approaches is really targeted as how do we find the patients that need it the most, that are suffering despite, everything that they can do to help. And so those are the patients that we're really trying to find better options for. And so there's several different landmarks moments that have happened in the treatment of sickle cell disease, really starting stem cell transplant first came on board is actually performed in a patient from Louisiana. It wasn't done here in Louisiana, but it was from a patient who had a type of leukemia and also had sickle cell disease. Terrible combination, but she received a stem cell transplant and it cured both. And so after the 80s, as stem cell transplant got safer and safer, the stem cell transplant got offered more and more to patients who have the most severe forms of sickle cell disease. But a stem cell transplant is really difficult. There's a lot of risks, a lot of side effects that can happen. And the success rate is really dependent on your ability to have a perfectly matched donor, which is a challenge for a lot of patients with sickle cell disease. Less than 20% are going to have that when it comes to a matched family member. And so there isn't an option for those patients, at least historically. We've gotten better at managing the complications. So now we're offering more what would have been considered high-risk stem cell transplant, but they still come at a cost.
Gene therapy is now changing that conversation in a meaningful way. Can you walk us through what gene therapy for sickle cell disease entails and why it represents such a significant breakthrough in medicine?
Yeah, so, historically, it had been stem cell transplant was the only option for cure for patients with sickle cell disease. But as mentioned, it's just really risky, a lot of side effects. A lot of people didn't want to go through the process, understandably. And so, it was really about 10 years ago now that the first clinical trials were being developed to do this new treatment called gene therapy. So what gene therapy is there's two different approaches that have been FDA approved that can either edit the genes or that can add a gene. So the process is actually where a stem cell transplant is using a donor from somewhere else. This is actually using someone's own stem cells. So it bypasses a lot of the complications we saw, and matching goes away, and some of the late complications from transplant are not a risk with gene therapy. And so there's a lot of advantages there. And so the process is that we collect the patient's stem cells, and then we're able to either edit their genes. They get sent off to a lab where their genes are either edited or a new gene is added to make a more functional hemoglobin. And I think it's just the first step in what we're going to see in the future of medicine too. I think this is going to eventually become much more common as we get further down the road and we see how safe these products are and how they can be impactful. So after we've successfully edited the genes, we then give it back to the patient. They unfortunately still need chemotherapy similar to a stem cell transplant because we have to eliminate their stem cells that are producing the sickle cell. And then after the chemotherapy, about a week of chemotherapy, we give them their new modified stem cells back. And within a few weeks, it hopefully is starting to make hemoglobin that doesn't sickle.
That's really reassuring to hear for the future of medicine, to recognize this need for health equity. And I'm so happy to see that happening here across the country, but also knowing that we at LCMC Health and Manning Family Children's are doing our part as well.
Yeah, no, absolutely. And I think also what this represents is also bigger than that too, is that I think some of the challenges that sickle cell has faced over the years has not been a priority. We as a medical community has failed patients with sickle cell. It has not been up in front, and it's really lived in the shadows, unfortunately. And there's a lot of reasons behind that. And so historically, the research funding for sickle cell was abysmal, despite being the most common inherited blood disorder in the world, almost 10 million people that have it. The research funding was terrible. And so just as an example, here in the U.S., we have about 100 to 120,000 patients with sickle cell disease, which predominantly affects Black and African American. You compare that to another genetic disease that primarily affects Caucasian and white population, the cystic fibrosis, that only 30,000 people have, so less than a third of the population. Yet the funding for cystic fibrosis was almost 10 times that of and so it's was forgotten about for a long time. So it's really important that these therapies are now available and hopefully shining a light on sickle cell, not just the most severely affected patients that are going to get it, but at all patients.
From an operational standpoint, implementing gene therapy is incredibly complex. What infrastructure and multidisciplinary coordination are required to successfully launch and sustain a program like this at Manning Family Children's?
Yeah, so I think there's a lot of people that are involved, and as the physician, I'm probably the least important in that whole process. So there's probably 30 or 40 people that have been involved in getting this done. I think the first step is getting a commitment from the organization. So having Manning Family Children, LCMC, step up and say, we think this is a priority. There's a lot of places out there that this therapy is not available because people won't take that jump to invest in gene therapy. And so I think first it starts with that. But then on top of it, we have to have a system where we can identify which patients need it most. We have a large sickle cell population we treat at Manning Family Children's and at Tulane. And so you need the population that you're going to treat. And then on top of it, you need people that are going to be help collecting the stem cell, the cell therapies lab that's going to be, keeping the stem cells, spawing them out. It's the nurses, the nurse practitioners, it's the pharmacist. It's really the whole group that makes this successful. You can't just do this anywhere. And I think that's shown by, we're the only place in Louisiana that's going to do it. I don't think anybody else has really shown interest in Louisiana or has the ability to do it.
I think it's also important to note that while Manning Family Children's is such an amazing resource for our New Orleans community, it really has such a wider reach as well. I mean, y'all really have become a just incredible resource for the entire Gulf South region.
Absolutely. And I think the reach is going much further than just New Orleans. And half the consults, probably more than half the consults, are coming from outside the New Orleans area because, we have pretty good sickle cell care here in New Orleans. We have a transition clinic, we have a large pediatric clinic, we also have an adult clinic. But once you get out into the rural communities, there's not a lot of adult hematologists that take care of sickle cell patients. That's when the risks are the greatest, where people are really suffering. And so I think that's really important, is that we're able to reach all patients, not just the ones in uptown New Orleans where the hospital is, right? And so I think that's been a really great thing to be a part of. So we get a lot of patients from Mississippi as well. And honestly, we just infused the first patient for gene therapy. We're ahead of Arkansas, Mississippi, Alabama, Georgia. None of those other southern states have actually infused a patient for gene therapy. And so, it's important that here in Louisiana, I think often we struggle with, we're just trying to keep our head above water, right? Like we tend to be near the bottom in health outcome. And it's time for us to say we've had enough. It's not good enough to just get by, and we need to go forward and try to lead the pack.
This one patient that you've kind of been referring to, that has received this therapy, I understand he has aspirations to become a pilot, something that might not have been possible before without this. From your perspective, how do these patient outcomes help inform strategic decision-making and investment in innovation?
Yeah. And so, I meet a lot of patients with sickle cell disease. In the past 6 months, I've talked to over 60 patients who are interested in transplant or gene therapy. And I always lead off the conversation with the same question, which is, how has your sickle cell disease affected you? And I just leave it very open-ended as a simple question. And it's surprising how that is a very emotional question for a lot of people. Half the patients, I'd say, break down in tears just talking about it, because it really humanizes what we're talking about. We focus so much on how many times you get into the hospital, how many times you go to the ER, how frequently you're in pain, which is important. That's the medical component, but there's the human part of it, of how is this affecting your life? What are you not able to do that you had dreams of accomplishing? And we see people all the time that they try to go to college and they just can't keep up because they're in pain. They're having to go to the ER. They're missing too many classes. You have people that can't stand on their feet long periods of time because their pain is too much. And so they're not able to reliably hold down a job. Or you find patients that, have these dreams of doing something that their sickle cell is preventing. That's this patient wanting, his lifelong dream was to be a pilot. He took all the courses, super smart guy. He was doing everything he needed to do that. He was going for his license, and they sent him a letter that specifically said, because of your sickle cell disease, you will not be considered for a license. And so, in that letter, ironically, which came through multiple appeals he made, it said, we would reconsider you if you had a stem cell transplant or gene therapy. He immediately came to our doorstep. How can I help realize my dream? He didn't have good matches for a stem cell transplant, so it was going to be really high risk. And so he wanted to go forward with gene therapy. And outside of his dream being crushed because of, unfortunately, his sickle cell disease, he also suffered a lot from pain and other complications. So it was a way to help with both. I also want to make sure, as I'm talking about this, I'm not phrasing it as all sickle cell patients aren't able to live very accomplished lives. So I want to make sure we also acknowledge that what we're talking about is the most severely affected patients.
So Manning Family Children's is helping bring this level of advanced care to Louisiana. What does this mean for access to care in our region, and how does it position LCMC Health as a leader in delivering cutting-edge treatments locally?
Yeah, so as mentioned before, these therapies are only really available here. And we have an open door policy. Anybody in the state, anybody in the region that wants to come and talk about these therapies, we'll set up a visit and we'll find a way to make this work. And so I think the days of old also, I think, of just build it and they will come, that doesn't work. Yeah. Coming from a community that was forgotten about in rural part of the world, and where medical system was not the best. And I think I had felt some of those challenges of growing up. You have to go out there and find people that need these treatments and make sure that they feel welcomed and that they know it's the right place to be and that they're getting the best possible care. And that's really what we're focused on. Lake Charles, if you live in Lake Charles, Alexandria, Monroe, Shreveport, wherever, we're here to help. We're here to help you find a way to us and help support you as you potentially go through something, if this is what you want.
Looking ahead, as more advanced therapies emerge, what should healthcare leaders be doing now to prepare? And what lessons from your experience could help other systems successfully adopt and scale this kind of innovation?
Yeah, so I think this is just the first step. And so I think this is really important because we're very early to the game in this new, really innovative treatment. And part of it is, this is where the patients live and this is where this needs to be. But also, as we gain experience, we gain knowledge through this process, there's going to be more of these that come down the line. Like I expect gene therapy is going to explode in the next 10 to 20 years. We'll be treating a wide variety of patients. And we've already seen some of that. And we want to make sure we're on the forefront of that because our patients deserve it. The people of Louisiana deserve it. And so how can we make sure we're in a place to not just follow what others are doing, but help lead the way? So I think this is a perfect example. It's when we first talked to the administration, it was like, I don't know if this is a big thing to undergo, and is not many people have gotten it in the entire world. And it was really identifying that this is really important to do, and this helps set us apart and helps the patients of our community. And so I think that's you have to invest in the future, not just the present. And that's what this is.
And before we end, one thing I'd also like to bring up is the very common misconception that sickle cell only affects African American and Black patients. Could you speak to that a little bit?
Yeah, no, you're exactly right. Around 90% or so of patients people with sickle cell are Black or African American, but that still means that close to 10% aren't. And so, at our hospital, we see a large number of folks from the Caribbean, from Honduras, from Latin America that suffer from sickle cell disease. There's also Mediterranean communities because of, again, the adaptation from malaria. In other areas where malaria prevalence was high, we can also see that as well. And then also, we always think that we know our background. And I think anybody who's done a 23andMe or one of those other ones realizes we're not what we think we are. So sometimes you can be surprised by you didn't realize it, and then suddenly. So absolutely, you can see it in all people.
This has truly been such an insightful and incredible conversation. And once again, we are so grateful for you taking time out of your very busy schedule to come be here with us. We always end by asking our guests what they do in their free time to keep themselves well. What helps you recharge outside of leading such a high impact program?
Yeah, so I have a beautiful family. My wife and 2 kids, I have a 9 and a 12-year-old. And so a lot of the, recharging comes from them. My daughter and I are going to be running the Crescent City Classic. Is that just a week away? Yeah, it's like a week away. So we've been training. So that's one thing that helps. I don't know how I'll do, but she's going to smoke me for sure. But that's definitely spending time with family, trying to be outside as much as possible. And like right now in New Orleans, it's pretty amazing. Getting out and being outside is definitely a stress reliever.
Well, thank you again for joining us today, Dr. Watkins, and thank you all for listening. Join us as we go beyond extraordinary on the second Tuesday of every month.